Dr. Richard Jacoby is one of America's leading foot and ankle surgeons. He's been treating and helping patients for more than 35 years. Dr. Jacoby recently added a powerful new weapon to his treatment arsenal, an MLS therapy laser from Cutting Edge Laser Technologies.
A lot of patients come in who have had treatments for years, and they have instant relief of pain.
It's pretty quick.
Patients like Betsy Acquire, who had tried nearly everything to alleviate her foot pain.
I noticed the swelling went down right away, and the pain was definitely less this weekend than it has been from one treatment. Yeah, I was amazed.
The MLS laser uses light to transfer energy to tissue. It relieves pain, promotes healing, and reduces inflammation.
Medication is a chemical that manipulates the chemical cascade of inflammation and brings ultimately more oxygen to the part. Well, this does the same thing, but without the side effects, because we're not altering all the biochemical pathways. We're altering only the pathway that we're interested in for that particular person.
It makes sense to anyone that's had any science background. You describe the cellular changes that occur at the mitochondria, and then they automatically know what you're talking about. And it's hard to say, well, that's not true, because there's a lot of research that says it is.
If a therapy can actually help at the cellular level and help improve the nerve rather than mask the pain, that's certainly a great benefit, and that would be a huge opportunity for practice, I think.
You'll get an effect up there.
Across the country, podiatrists who have used MLS laser therapy have consistently been amazed.
One of our staff members, she had plantar fasciitis and heel pain, and she had one treatment with the laser and helped her tremendously.
I've had just recently a patient come in with relatively acute swelling and tendonitis around her ankle joint. After one treatment, I was able to get about 95% of her symptoms resolved. And after 3 sessions, she was 99% resolved. And for a lot of patients, especially in our diabetic patients, this is almost too good to be true.
Plantar fasciitis is particularly responsive to the MLS therapy. Also, neuropathy is very responsive, and to the point where we've had patients after one treatment who said they can feel their foot for the first time. It's very impressive.
Also impressive is the ease of using the laser.
Our particular unit has preset settings for different problems. You hit a button and then you walk out for 5 or 6 minutes and go see another patient or set up your other laser you got right next door.
Podiatrists who are using the MLS technology are seeing vastly better results medically and financially. Patients generally pay cash for the treatments, and they do it eagerly.
The machine was paid for within the first 7 months of owning it. We have found patients actually quite willing to pay very little to no resistance, to the point where they've even said, you know, if it was twice as much, I would still write the check.
Money is really not a problem with this, because patients are very, very willing to pay for this, because it's something actually cheaper than their traditional treatments.
More and more people want non-surgical options, and in this economy, very few people can take a lot of time off work. So if you have a non-surgical option that can help people, I think a lot of people are interested.
If you wanted an alternative to medicine and surgery, a laser by far and beyond of any modality I've ever used in the physical therapy world, this is the best.
It gives us that edge. You're always looking for something that separates you from your competitors. And, you know, like it or not, the foot and ankle physicians in the area are competitors. And we feel that this technology, and in particular the MLS laser, has given us that edge to say we're different. And we have technology that is effective, and we've proven it clinically, and patients are getting better.